Research published last month in the Journal of Sexual Medicine revealed that guys that took ED meds like Viagra, Cialis, or Viagra were significantly less likely to have experienced early mortality than the rest of their cohort. Furthermore, men using these drugs experienced fewer heart troubles. These drugs belong to a class known as PDE5Is, phosphodiesterase type 5 inhibitors, which can also be used to medicate pulmonary hypertension. Viagra was invented by accident to help people with heart problems, so it makes sense that these drugs would have ancillary cardiovascular benefits for men. Researchers reviewed the medical histories of 23,816 adult males from 2006 through Halloween of 2020 based on insurance claims. All of the men used drugs like Viagra at least once during the period. This data was contrasted with claims from 48,682 males that never used PDE5Is. Insurance claims offer a wealth of patient data that can be used to advance medical knowledge. It informs us of medical visits, procedures, hospitalizations, and prescriptions, among other healthcare experiences. This also helps us infer health outcomes for patients. Contributors to this study came from the University of California, San Francisco, HealthCore Inc., and the Huntington Medical Research Institute. This medical data was drawn from the HealthCore Integrated Research Database, which stores insurance claim information for more than 50 million patients using commercial health insurance. Researchers collected prescription data from HealthCore and compared that information to the National Death Index. This United States government database gathers information regarding mortality outcomes for all recognized deaths across the country in order to advance medical knowledge, among other goals. This study aimed to see how PDE5I prescriptions related to short-term mortality risk. They tracked PDE5I patients for a mean time frame of 37 months, while the drug-free group was followed for a mean of 29 months. The data was very promising for users of Cialis and similar medications. They were around 1/4 less likely to have died in the selected time frame and also had a 13% lower incidence of a major cardiac event. Specifically, cardiovascular death rates were 39% lower and several other cardiovascular events were significantly less frequent, including unstable angina down 22%, heart failure down 17%, heart bypass surgeries down 15%, and researchers also analyzed differences in heart problems and death rates among patients taking PDE5I drugs. They compared the quarter of patients that used the least of the medication to the quarter that used the most. The difference was 5.5 pills per patient versus 191.2 pills per patient. Those that took less of the drugs were 55% more likely to have had a major cardiac event and were 51% more likely to have died over the time frame tracked. While this doesn't directly prove causation, the data is still promising for men that are interested in maintaining a happy and healthy sex life. Men that are sexually active generally have a lower mortality rate than those that don't have sex. It's also true that men that aren't healthy enough for sex probably aren't taking Viagra. The group of men that opt for erectile dysfunction treatment have inherently different characteristics from those that never get a prescription. On the other hand, there are many reasons why these drugs would have a beneficial impact on mortality risk and heart health. PDE5Is provide sexual enhancement via the same mechanism that they can improve circulation. Drugs like Cialis and Viagra also act on your arteries, blocking phosphodiesterase enzymes in cardiovascular tissue. This, in turn, helps the blood vessels dilate and get more blood to the heart. It's also hypothesized that these same drugs can reduce heart inflammation and prevent clots. Similar drugs are increasingly prescribed for pulmonary hypertension. This research lays the groundwork for more intensive research investigating the incredible potential of drugs like Viagra to change people's lives. If you found this video informative and would like to learn more about Viagra, Cialis, or any of the other drugs mentioned in this video, please click the link below in the description of this video.